The recent funding cuts by the US have been attributed to the rise or surge in the new HIV cases. According to the Kenya National Bureau of Statistics, the donor funding for the HIV program has slowed down the progress in scaling down the disease. This revelation came as Kenya joined the globe in marking the World AIDS Day, where it emerged that the bulk of Kenyans with new infections are in the age of 18 to 35 years. This is a public health principle. This, even as the public health principal secretary, Mary Muthoni, revealed that the mother-to-child transmission of HIV has drastically reduced.
At Kangemi area in Nairobi, young people converged to mark the World AIDS Day. The event, organized by Rose Wanja Nyarari in collaboration with Kangemi youth groups, also saw public health PS Mary Muthoni in attendance. Muthoni applauded the gains made in the fight against HIV and AIDS.
Last 20 years, over 2 decades ago, we have reduced new infections by about 72%, which is really commendable. The mother-to-child transmission has reduced by 35%, and we have also reduced AIDS-related deaths by 90%. So that is progress that we have seen, but that does not mean we drop the ball on the same. What it means is we must eradicate.
In AIC Kajiado Child Care Center, children rescued from female genital mutilation, early marriages, gender-based violence, and children with disabilities gathered for celebrations of World AIDS Day. Here, speakers emphasized the challenges posed by financial constraints and the resilience of communities driving innovation in the HIV response.
You know, when funding declines, then there's a rise. But again, because of the various interventions, there's been a lot of hope as far as combating HIV and AIDS is concerned.
In terms of HIV/AIDS, HIV/AIDS affects also the disabled, including even the children. And we sensitize them, we educate them, and we also educate their parents about it. And being young people that have a future, we tell them that HIV/AIDS can become a barrier.
The same message resonated in Kakamega, where the national government was urged to allocate funds in its budget to support people with HIV following the withdrawal of international donor funding. Kakamega County previously received more than 1 billion shillings in donor support to combat the spread of HIV and provide treatment.
Tunaomba serikali yetu kuu waweze kuhakikisha ya kwamba wakati wanatengeneza bajeti basi waweke hizo fedha ili watu wetu wasiumie. Sisi kama gatuzi la Kakamega, Wizara ya Afya, pia tumeweka mikakati ya kuhakikisha ya kwamba zile services zenye USAID ilikuwa inatoa kwa wananchi tumeziweka sasa kwa program yetu ya kawaida, ile tunaita integration of those services.
In his message to the world, UN Secretary General Antonio Guterres said although HIV new infections have dropped by 40% since 2010, the progress might be hampered by reduced resources.
But for many people around the world, the crisis continues. Millions still lack access to HIV prevention and treatment services because of who they are, where they live, or the stigma they endure. Meanwhile, reduced resources and services are putting lives at risk and threatening hard-won gains.
This year's theme is Overcoming Disruption, Transforming the AIDS Response. As the world joins in on celebrating World AIDS Day, the stakeholders have noted that it is important to sensitize the young generation on HIV and AIDS. For KBC Channel 1 from Kajiado County, I am Teresa Mutai.